Hi everyone, Ashlyn Giza YouTube channel. Today we are going to talk about emergency department visits and how sometimes you can be treated wrongfully and you can just be mistreated. So I had 2 ER visits a month ago, and one of them I talk about in my previous video. It was when I was post-COVID. Usually emergency departments do want you to come in if you are having shortness of breath, and that was a symptom that I was having, and it was scaring the crap out of me. So I decided better safe than sorry and go get a chest x-ray or have them listen to my lungs or something, because first of all, I was about ready to go on a trip. Second of all, I wanted to make sure I wasn't sick before I went to go visit family. And third of all, which is just as important as the first and second reason, is I didn't, I didn't want to have another pneumonia. So, sorry, I had to grab my pop from my son. So I went to the ER, and I'm telling this nurse what's going on with me. I'm saying I'm not really feeling the best. I'm having coughing, like a tickly thing in my throat. Then I had sinus infection, and then I got tested positive for COVID. Then I got a negative test, and but I still am getting like shortness of breath. So I came in here to get it checked because I'm nervous it might have turned into pneumonia. So the nurse is listening to me, and she's typing things in the computer, and then a doctor comes in. I didn't even know she was a doctor, because like when a doctor enters the room, hold on, sorry. So usually when a doctor comes in, they knock really hard, they like that. They don't just do a quick. And this lady comes in, and she's very rude to me, and she just like points at me, and she's like, "You have COVID." And I'm thinking, okay, yeah, I'm thinking in my head, yeah, I just told the nurse that I'm post-COVID. And I'm thinking, why is she pointing her finger at me? And again, I'm not knowing she's a doctor, because she didn't really introduce herself. And she didn't say she was a doctor, so I thought it was another nurse, because sometimes in the emergency department, you have more than one nurse come in. So I'm not even knowing who she is, and then, so she asked me to repeat a couple things, so I tell her what's going on, and then I said, well, and I also came here to kind of get an answer whether or not I should continue I should continue planning my travel to go see my family member if I'm short of breath. And she's like shaking her head no to my husband as my husband's trying to ask her questions. She's interrupting him, not listening to him, shaking her head no to him, and telling us that we shouldn't travel. Going by CDC guidelines, it says that all you have to do if you have COVID is isolate for 5 days. I isolated for 2 weeks, and I even got a negative COVID test, so I'm not quite sure what that lady was talking about. And, I kind of felt like she should have gave us some reassurance of whether or not we should go. She didn't really give us an answer. She just said, if you're flying with people, I definitely wouldn't go. And we were trying to tell her we weren't flying, we were driving. And then when we finally were able to tell her that we were driving, then she was like, oh, okay, well, I don't know, that's you guys' choice. And that's how she answered it. She wasn't nice about it. Her bedside manners sucked. I did call, so did my husband, and report her to the administrator at the hospital. I'm not sure if that did us any good, because the next time I went to the ER was maybe like almost 2 weeks later. So I go to the ER because I'm still short of breath. That was my main reason for going to the ER. I think any of you guys would probably go to the ER for a second time if you're still short of breath after like almost 2 weeks. So I went in again. My urgent care wasn't open. My family doctor's office wasn't open, so I went in again. And the doctor checked me, and he was like asking me questions, but he wasn't asking them nicely. He was interrogating me. He was like, so is there pain in your chest? How long have you been short of breath? Why did the doctor on your last e-visit give you antibiotics? Sounds like it's malpractice to me. If she didn't really actually see you, she just sent in antibiotics. And I said, she did see me. She saw me on a video visit. So how is that malpractice? And then he goes, what's the pain in your leg? And I'm like, I don't know, like a 6 or 8. And he's like, what's the pain in your chest? Because I told him I was short of breath and that my right leg hurt. And I'm like, I think like an 8, kind of the same as my leg. And then he's like, okay, so your blood pressure was really high. Have you talked to your family doctor about your blood pressures? And I'm like, well, usually when I come to the ER, my blood pressures are high. I don't often get high blood pressures. I can call him or send him a note and tell him about my blood pressure. I said, that could be the reason why I'm short of breath? And he's like, it can be, but that's something you might want to follow up with your family doctor. It does say that your oxygen is 98, so we can do a chest x-ray and we can get an x-ray on your leg. And I'm like, okay, sounds good with me. And then he's like, so what's your pain level on your leg again? And I said, I think like an 8. And he goes, well, you just said a 6. And I said, well, yeah, it's like between a 6 and an 8. It's kind of the same as my chest. I don't really know what number to really give you. I mean, I just know that I'm short of breath and that my leg hurts. And he goes, oh, okay. Well, you just said that your pain level was a 6 and now it's an 8. And I'm like, I don't know what number my leg is. My leg pain is. I'm just here because my leg hurts. And so he was like interrogating me. Then when he, before he ordered an ultrasound and had the ultrasound tech come in, he put a guilt trip on me and said, I had to wake up the ultrasound tech so she could come in and do an ultrasound on your leg. So she should be here anywhere from a half hour to an hour. And I'm like, okay, and thank you. And that I'm kind of thinking in my head, and my husband's thinking in his head, why would this doctor have to let us know that he's waking somebody up? It's okay to let us know that the ultrasound tech might not be able to give me my ultrasounds for a half hour to an hour, but it's not okay to make someone feel bad that they have to wake the ultrasound tech up from their sleep. That's not right. And why is the doctor, when he's asking me questions, interrogating me? Why is he just not asking me questions like how a normal doctor does, like what's your pain level, and allow me to answer, and when did this stuff start, and allow me to look at a calendar, or like the calendar on my phone or something, so I can thoroughly give him dates and times as to when I started being short of breath and different things like that. Not interrogate me and not even let me get the opportunity to look at a calendar and answer his questions, and just over talk me. That was terrible bedside manners. And he also guilt tripped me and looked at my past history of doctor visits I've had, and mocked the fact that I've been in the ER 4 times this whole year of 2022. And I don't really think that's funny, and I don't think that's something that you should throw in somebody's face either, because I looked it up on Google, and it said that the average person goes into the ER 1 time, and I went in 3 more times than the average person goes in. And that's with me being a cancer survivor and also having extra health conditions that other people don't have. So I'd say that going in 4 times within 12 months isn't that terrible. I mean, it's not my fault that my body decides to act up at night. It's not my fault that I'm getting sick. It's not my fault that shit happens. So that was inappropriate too, to state how many times I've been in the ER. It's like, why don't you just sit there and shut up and do your job and be a doctor? If you didn't want to be an ER doctor, then you probably should have chose a different position. And if you didn't want to see the same person come in all the time, then maybe you guys should give more accurate diagnosis, and then that way we could figure out what the problem is and get it resolved, so I don't have to keep fucking coming in. That's my train of thought. So to some of you doctors out there, you can try a little bit harder to have more patience with people and compassion, and with being in the field of compassion, you should have compassion and empathy and listen carefully more to what your patient is saying. Not all doctors are like that. I'm very aware of this. I even have doctors that were in my family that are now retired, and I have one that's still an active doctor. And I used to be a CNA myself, so I know how I deserve to be treated. I think this is probably the 2nd or 3rd video that I've made about doctors and nurses treating me poorly. And I don't deserve it, and neither does anybody else. And I feel that we can do a lot better. So those are my stories. If I'm sick again, I'm just telling this to my subscribers, people who are listening. If I'm sick again and it's in the middle of the night when the urgent cares are closed, or when my family doctor's office is closed, I'm still coming into the ER. So good luck to you doctors that are annoyed by me and don't want to see me there. But if I'm not feeling good and nothing else is open, I'm going to the emergency department and getting taken care of like I deserve to be, like anybody else deserves to be. So anyways, to my children who are watching this when they get older, or whenever I pass away, stand for yourself. Don't let any doctors put guilt trips on you. If you feel something's wrong with your body, keep going to get second opinions, and keep going to to get checked to make sure something isn't going on and that everything's okay. Because sometimes doctors miss things. I mean, they're human. Sometimes you get a doctor that doesn't really want to listen. So fight for yourself and don't give up until the problem's resolved. And that doesn't just go for my children. I guess I'm saying that to everybody who has sicknesses and disease, or maybe, and they aren't being heard from the physicians. So I just wanted to talk about that, and I will be on with another life topic.